Imagine a typical clinical scenario. A patient presents with symptoms suggestive of a lung pathology. The initial diagnosis often involves imaging, revealing detailed information about the lung anatomy, such as nodules or abnormal tissue regions. Bronchoscopy allows clinicians to enter the bronchial passages to collect tissue samples for a more precise diagnosis. During bronchoscopy, navigation through the complex bronchial tree is essential, especially when targeting small lesions. Robotic-assisted navigation offers enhanced precision and stability, enabling clinicians to reach specific lung regions more accurately. As a result, these navigation technologies play a critical role in improving diagnostic and therapeutic outcomes, making them an indispensable part of modern pulmonary interventional procedures. However, due to the complex tree-like structure of the bronchial system, inexperienced doctors may become disoriented and lose their way during the procedure. Pure visual navigation, based on preoperative CT images, plans the motion trajectory of the bronchoscope, providing guidance and support during the surgery. Therefore, how to estimate the position of the endoscope in real time during surgery is an important topic. By aligning intraoperative images with preoperative CT scans, it becomes possible to identify the current position of the endoscope, providing the surgeon with path guidance. However, due to sparse texture and complex artifacts, estimating camera pose is difficult. 3D models reconstructed from preoperative CT can generate virtual images with pose ground truth, providing a structure prior for navigation. In this work, we propose a novel entiluminal navigation method based on domain adaptation. Specifically, during the preoperative phase, the airway tree is segmented from the CT images, generating a large database of virtual representations. These virtual images can be compared with each intraoperative image based on similarity, allowing the identification of the closest match. The camera poses corresponding to these matched virtual images are assumed to represent the camera poses for the intraoperative images. The key issue is how to design an efficient style transfer network that bridges the real domain and the virtual domain. Conventional methods employ a single neural network to transfer the real image to the virtual image, matching the closest images in the database. However, due to unpredictable artifacts such as blood, mucus, and bubbles, existing methods generate poor quality images, leading to matching failures. This paper presents an artifact-resilient image translation method incorporating noise-resilient feature extraction and global local translation strategy. It can effectively generate clean virtual images from artifact-affected images, facilitating accurate registration. For the pipeline, we divide the image translation step into two steps, a local translation step and a global translation step. Due to the lack of artifact-free images in real-life clinical settings, we design a pseudo-labels generator based on differential 3D reconstruction and style transfer techniques. Additionally, a noise-resilient feature extraction strategy is proposed. We introduce a novel contrastive learning strategy that leverages the inherent noise-resilient features from the virtual domain as a reference to guide the extraction of features from noisy images. In real surgical scenarios, there are many unpredictable artifacts such as blood, mucus, and bubbles. The proposed ARTNet mitigates these effects by translating artifact-affected real images into a unified virtual domain with clearer structure. Owing to its strong performance, ARTNet improves a range of downstream tasks including lumen detection, depth estimation, and camera pose estimation. Notably, it suggests a promising paradigm by training foundation models exclusively on virtual data and converting real images into the virtual domain at inference time. Zero-shot performance on downstream tasks becomes feasible.